Let's go to the next slide. What I'd like to talk about today is what is the evidence related to obesity prevention, especially at the community level. Obesity has been on the rise for over the past 2 decades, and I think most of you on the phone know that. Between 1988 and 1994, as well as 2009 to 2010, the obesity rates among children and adolescents aged 2 to 19 increased by 69%, or 10% to 16.9%. Looking at both overweight and obesity combined, nearly 1 out of 3 children was overweight or obese between 2007 and 2008. The obesity epidemic continues to be a challenging health concern. Next slide, please. Obesity is a national epidemic. It increases the risk for numerous health outcomes and also causes higher medical costs and a lower quality of life. Obese children are more likely to have high blood pressure, high cholesterol, diabetes, breathing problems, joint problems, and other chronic diseases. They're also more likely to develop social and psychological problems. In addition, obese children are more likely to become obese adults, which is even more problematic. Chronic disease associated with obesity, such as heart disease, stroke, cancer, and diabetes, are among the most prevalent, costly, and preventable of all health problems. The medical care costs of obesity in the United States are staggering. In 2008, these costs total more than $147 million. By addressing obesity, we can help reduce the risks of life-threatening, costly, chronic conditions and help address significant costs for the healthcare system. Next slide, please. What I'd like to focus on today, just really quickly, is a significant problem in terms of the scientific evidence. We know obesity is a problem of caloric intake and expenditure of calories, out. But the problem is the evidence base is very, very weak, especially at the population level. So one of our major goals is to build this population-based evidence. The strategy is to link local and multi-sector partners and scaling up that knowledge to state and national efforts. Next slide, please. The high priority strategies and indicators that we have are, number 1, increase access to healthy foods and beverages by providing access to healthier food and retail, or healthier food, retail, and farmers markets. Secondly, to implement food service guidelines and nutrition standards where foods and beverages are available in priority settings such as early child care centers and work sites. Next slide, please. The third is implementing policies and practices that create supportive nutritional environments in schools, including establishing standards for all competitive foods, prohibiting advertising of unhealthy foods, and promoting healthy foods in schools, including those sold and served within the school meal program from USDA and others, as well as then finally increase physical activity access and outreach by creating or enhancing access to places or physical activity which focus on walking combined with informational outreach, and design our communities and our streets so that physical activity is an easy thing to do, or that individuals can be easily physically active. Next slide, please. What I'd like to share with you is, and it's very exciting news, we have a number of places or localities around the country that are starting to report success. Next slide, please. Those promising localities include states such as California, Mississippi, New Mexico, and West Virginia. But then we also have individual communities or cities such as Anchorage in Alaska, El Paso in Texas, Granville in North Carolina, Kearney in Nebraska, New York City, Philadelphia, and Vence in North Carolina. Next slide, please. These locations that are reporting success are extremely exciting, but we need to, investigate what they're doing, how they're doing it, what it's taken to achieve those decreases in body mass index or obesity rates. So from CDC's perspective or the federal government's perspective, I want to share a few things about what we're doing relative to documenting that success as well as supporting it. The first is a funding announcement or a federal state-level grant program that we're starting right now this year. It will be announced just in the next couple weeks in August that there will be state-level grants that focus on healthy eating and active living with a new emphasis that we have not ever done before, that it's not just community-level efforts in terms of schools and governments and work sites, but we're incorporating healthcare and clinical connections to the community that support and synergize the efforts to support healthy eating and active living. So that's a grant or a funding mechanism. But the second is a different approach of supporting and encouraging new lines of research that will build the evidence base for us over the next coming years. The one area in particular, one level of focus is a partnership called NCORE, or the National Collaborative for Childhood Obesity Research. And it's a partnership between the NIH, USDA, CDC, those are the three federal agencies, and then the Robert Wood Johnson Foundation, which is a private foundation. And we're doing a whole host of different things that accelerate or are attempting to accelerate what we know via research and evaluation. But two things I'd like to point out or two activities that I'd like to point out are the Registry of Studies, which is, it's a very simple concept where we are going to put in one location on the NCORE website, which is ncore.org. It's going to be one website that links all these, a number of major research and or evaluation studies in terms of their instrumentation, their methodologies, their analytical approaches to looking at population-based obesity prevention. So that's one. Another is, excuse me, a project called Childhood Declines in Obesity, What's Working? And this is, if I could just step back for a second, and I shared some of those locations around the United States that are showing declines in obesity. What we're doing is actually going to those sites and trying to document and do a deep dive in terms of assessment of what did they really do. I mean, what were the components that had to happen? How much funding did they need? What types of interventions did they engage in? Were they policies? Like just the whole gambit of what you can wrap your mind around. So that's another thing that's happening. Next slide, please. On this slide are just a few resources that you all might be interested in terms of evaluation and helping you recognize how to assess success and how to evaluate those successes, just to have those in your back pocket.